who undergo surgery, they remain on ventilator for few hours and subsequently in ICU for a few days. Now these patients who are in ventilator, they retain secretions in their respiratory tract. Their muscles also become little weak, hence they require very active physiotherapy to clear the secretions from respiratory tract, and also they require physiotherapy to gain strength so that they can have a very appropriate post-operative recovery. Thanks.
Physiotherapy is an important part of neurosurgical care, especially in post-operative periods for patients who have undergone any brain or spine surgery. Physiotherapy is a must for your quick recovery and to make the patient independent again and a productive member of the society. Physiotherapists are an integral part of neurosurgical team. Their assessment is sometimes required in preoperative cases also, where we assess the patient's independence and patient's ability before surgery, and we try to improve it after surgery when the patient has undergone a successful operation. Also, it is very important to learn that physiotherapists are very important in patients who have undergone any surgery or who have suffered from a stroke. So any patient of a stroke, surgical or non-surgical, requires regular prolonged physiotherapy, and physiotherapy is the key for them to become independent member of the society. Thank you.
So physiotherapy takes an important part in the management of the spine patient and in the integral part of the therapy in the spine. So we are doing physiotherapy for all our patients for the conservative management of slip disc, sciatica, and it's a major role in rehab of the patients to make the patient independent and have a healthy life.
Hi, as we all know, any orthopedic procedure involves extensive physiotherapy and rehabilitation for the process to succeed. Physiotherapist is an integral part of any orthopedic department and service, and they are one of the pillars, I would say, of any successful orthopedic unit.